Okay, let's unpack this. For years, I think many of us, myself included, thought we had a pretty good handle on, when to reach for calcium during a queen's labor. If things slowed down, if she looked tired, it was kind of the first thing you'd grab, right? It just seemed like the common wisdom, the go-to solution for a difficult birth. But then new research comes along and it absolutely shakes that foundation. Today, we're taking a deep dive into Dr. E's latest blog post titled, "When Should You Give Calcium to Queening Cats?" Our mission here is to pull out the most important, maybe game-changing insights from this incredibly valuable resource, helping you navigate the complexities of feline reproduction with, hopefully, newfound clarity and confidence. Right off the bat, Dr. E offers a truly eye-opening finding that challenges everything many of us believed. Most difficult cat births are, in fact, not caused by low calcium. Think about that for a second. The article immediately hits you with the data from a significant 2021 study involving 35 queens experiencing labor problems, or what we call dystocia, that's simply a difficult or abnormal birth. And what did they uncover?
A shocking 0 cases of actual low calcium during active labor. 0. Even more surprising, 11 of those queens actually had high calcium levels. This really forces us to completely rethink our approach, doesn't it?
Wow, 0 cases. That flies directly in the face of what so many of us in the breeding community have been told and honestly have practiced for decades. It really does. It makes you wonder then if we've been chasing the wrong culprit all along. If it's not low calcium causing these issues, what is it? And how does this fundamentally change what we should be doing, minute by minute when we're on the whelping floor facing a difficult birth? It completely upends what so many of us were taught or just assumed. The practical implications, for anyone who's ever anxiously watched a queen struggle, are absolutely huge, really huge.
You're right, it's a monumental shift in understanding, and that's exactly what this deep dive is all about. Moving from assumption to evidence, Dr. E's post lays out a very clear roadmap, almost like a TLDR summary of key takeaways, and we're going to unpack each of them. First, we'll delve into why most feline dystocia isn't about low calcium and what the evidence does show regarding calcium levels during difficult births, normal or even high, apparently. Then, we'll tackle the absolute cardinal rule. Never give calcium before true stage I labor begins. This might sound counterintuitive, maybe backwards, but pre-labor supplementation can actually suppress the queen's own natural calcium mobilizing system right when she needs it most. We'll also break down the safest oral calcium options for home use, specifically gels that contain citrate or ascorbate, and crucially, why injectables are, without exception, for veterinary supervision only. Seriously, don't touch those at home. A truly critical point we'll cover is that if you see no improvement within 30 to 45 minutes of calcium administration, that's your definitive signal to call the vet. It's not a cue to give more calcium. That window is key.
And this is a big one that catches many off guard. The peak calcium demand actually occurs during lactation, specifically in the first 1 to 3 weeks after birth, not during labor itself. So we need to be vigilant for signs of eclampsia after queening, post-birth. Finally, we'll talk about choosing multi-salt calcium formulations over a single-source calcium carbonate for better bioavailability, basically. How well her body can actually absorb and use the calcium, especially in stressed queens. It's a lot of ground to cover, I know, but each point is vital for improving outcomes. So let's dive straight into the truth about what really causes those challenging cat births and why we need to move away from this sort of knee-jerk blame calcium for everything mentality. Dr. E's research makes it clear it's rarely about a simple calcium deficit. Often it's something else entirely. Her work details the most common culprits for difficult queening sessions. Often it's something mechanical or a structural issue that calcium simply can't resolve no matter how much you give. For instance, malposition is a huge one. That's when kittens are presenting incorrectly. Maybe coming out breech, backwards or sideways or even upside down. This makes natural progression nearly impossible. Calcium won't rotate a kitten. Then there are oversized kittens, just physically too big for the birth canal, no matter how strong the queen's contractions might be. The physics problem, basically. Maternal exhaustion from prolonged labor is another significant factor. Queens simply get tired, especially with large litters, or if labor has been going on for a very long time. Their uterine muscles, like any other muscle, can fatigue. They just run out of steam. And of course, anatomical issues, like a queen having a narrow pelvis, perhaps from a previous injury, or even just her individual conformation, her build, can create physical barriers to delivery. These are all situations where administering calcium, while it might make you feel like you're doing something helpful, simply won't fix the underlying problem. It just doesn't address the root cause.
This is so important because, on the whelping floor, when you're in the moment, it's incredibly stressful. You're trying to quickly figure out what's going on. So how do I differentiate, practically speaking, between a queen who's just tired, maybe her contractions are slowing because of exhaustion, and one who has a malpositioned kitten stuck in there. And when might calcium actually help in those specific scenarios versus when it's completely useless, or worse, just delaying things? Because it sounds like we need a much more nuanced approach than just automatically reaching for the calcium gel every single time.
That's the million-dollar question, isn't it? And it's absolutely a critical distinction to make. Dr. Lee's article explains that calcium does become genuinely helpful, but only in very specific situations where the problem is truly related to uterine muscle function itself. For example, if weak contractions are affecting normal kitten positioning, meaning the kitten could come out, there's no obvious mechanical blockage, but the contractions just aren't strong enough or frequent enough to actually move it properly through the birth canal. That's uterine inertia. It's also potentially useful when large litters are genuinely draining the queen's energy reserves and calcium stores, and her uterine muscles need that extra kick to keep contracting efficiently. And it's undeniably crucial for supporting recovery during the heavy demands of lactation, which is a whole different beast we'll definitely get into shortly. The key insight here, as Dr. E points out, is that calcium powers muscle contractions. It's like the fuel for the engine, right? But it only helps when weak contractions are the actual problem. It won't solve mechanical issues like a kitten stuck because it's sideways or simply too large for the pelvis. You can administer all the calcium in the world, but if that kitten is malpositioned, it's not going anywhere, and you're just delaying crucial veterinary intervention, which is the real danger. This leads us perfectly into understanding the science behind calcium in cats, and why their physiology as obligate carnivores is so unique and, well, key to this whole discussion. Your veterinarian will tell you the cats, by nature of their high-protein diet, naturally keep their calcium system highly active and efficient. Their bodies are essentially primed as ready for the calcium demands of birth and nursing. It's quite remarkable. Think of it like this. Because their diet is naturally acidifying, it keeps their parathyroid system, that's the tiny gland that controls calcium levels, by signaling bones to release or store calcium, constantly working and highly responsive. It's always on alert. This incredibly robust and efficient system works best when it's not interfered with prematurely, ensuring that calcium is mobilized exactly when and where it's needed most. You don't want to mess with it unnecessarily. Dr. E simplifies the queen's journey by breaking it down into the 3 phases your queen goes through, which really clarifies when and how calcium is handled by her body, and crucially, what your role as a breeder is during each stage. First, during pregnancy, which typically lasts about 9 weeks, her body is naturally absorbing more calcium from her high-quality food. Her system is designed to build up reserves from her diet, not from supplements you might give her. So, your role here is simple but crucial. Feed her high-quality, complete, and balanced food formulated for reproduction and, critically, no extra calcium. Her body is perfectly capable of managing this on its own if she's on a good diet, and adding more can actually be detrimental, as we'll discuss. Next, we move into labor, which can last anywhere from, say, 6 to 24 hours, sometimes longer. During this phase, her muscles need calcium for those powerful uterine contractions that push the kittens out. This is where demand really increases. Your role here is to wait for confirmed stage I labor and then, and only then, consider support if needed, and ideally under veterinary guidance. This is where precise timing becomes absolutely everything. Finally, and this is truly the most physiologically demanding phase, is nursing, which typically encompasses the first 1 to 3 weeks post-birth. This is when there's a massive calcium drain from her body as she produces milk for her litter. The demands for calcium during peak lactation can be 10 times higher than during pregnancy or labor. It's huge. This is the period when you absolutely must watch diligently for signs of eclampsia, as this is when the risk of dangerously low calcium levels or hypocalcemia is highest.
What's fascinating here is how our queens are naturally set up for this. It really sounds like their bodies are incredibly efficient at managing calcium on their own, doesn't it? And our job as breeders is often to not get in the way rather than to jump to intervention. It's kind of humbling, really. Understanding these 3 distinct phases and what the true causes of dystocia usually are, it fundamentally shifts our approach from that reactive give calcium for everything mindset to a much more informed strategic one. It's about respecting their natural physiology and supporting it rather than trying to override it all the time.
Exactly, you've hit the nail on the head. And that leads us perfectly into one of the most crucial warnings in Dr. E's article, the deadly mistake, giving calcium too early. This is where many of us, honestly, myself included, have gone wrong in the past without even realizing the potential harm we might have been causing. Let's really drill down into the crucial mechanism of what Dr. E calls pre-labor calcium risks, When you administer calcium before true labor actually starts, maybe because you see some restlessness or nesting and you think she's about to start, your queen's body receives a signal. It interprets this external calcium as having adequate reserves already available in her bloodstream, so it thinks, okay, plenty of calcium around. In response, her body then dials down its own natural calcium-mobilizing system. Think of it like a dimmer switch being turned down on her internal calcium factory, which is mainly in her bones and regulated by that parathyroid gland. This creates a really dangerous situation, because when true labor finally begins and those mammary glands kick into high gear to produce colostrum and then milk, there's a sudden, massive calcium drain from her body into the milk. But her body's natural response system, the one that should be rapidly mobilizing calcium from her bones to meet this huge demand, remains suppressed because you turn that dimmer switch down prematurely by giving calcium too early. This makes her incredibly vulnerable to developing dangerously low calcium levels precisely when she needs it most. The critical rule your veterinarian will emphasize, and one that Dr. E stresses repeatedly, is to wait for confirmed stage I labor before considering any calcium supplementation. This precise timing ensures that the queen's natural regulatory mechanisms are fully engaged and responsive, ready to pull calcium from her bones and intestines exactly when those real calcium demands truly begin. It's about letting her body do its job first, without interference.
That's a huge point. It's so hard to resist the urge to jump in and do something, isn't it? Especially with a first-time queen who might be restless or nesting for days before actual labor really kicks off. So how do I ensure I'm not making this deadly mistake on my whelping floor? What are the absolute non-negotiables for identifying stage I labor, truly differentiating it from just, late pregnancy jitters or discomfort?
That's where partnering with your vet and truly learning to recognize stage I labor becomes paramount. It's not always easy, but there are signs. Dr. E explains that it's about distinguishing between genuine labor and just normal discomfort. Clear signs of stage I, which typically lasts from 6 to 24 hours, include intense nesting behavior, where she's really scratching, tearing, and arranging bedding with a driven, focused purpose, almost obsessively preparing her den. Not just casual digging. You'll often see persistent restlessness. She truly can't settle and keeps moving around, pacing, changing spots, often with audible panting or purring that sounds different, maybe more intense than her usual comfort purrs. Increased vocalization is another key sign, more crying, purring, or calling than usual, a clear change in her normal sounds. She might sound anxious or demanding. And dramatic behavior changes, like suddenly seeking your attention intensely, maybe trying to climb into your lap when she normally wouldn't, or conversely, hiding away completely and wanting to be left totally alone, can be strong indicators.
Some queens might also show a temperature drop to around 37.8 degrees C or 100 degrees ARVR, about 12-24 hours before labor kicks in, though this can vary wildly between individuals, and it's not a universal or absolute sign, so don't rely solely on it. It's just one piece of the puzzle. What's not stage I labor, and what you need to differentiate it from, includes occasional discomfort or restlessness that comes and goes, not persistent or driven. Mild nesting behaviors that aren't consistent or intense, like just casually pawing at bedding a bit now and then. And importantly, just normal late pregnancy discomfort. Queens get uncomfortable in their final days and hours. They might seem a bit off their food, maybe a bit grumpy, but that's not necessarily the start of active labor. The article emphasizes that learning these subtle differences and developing the confidence to recognize when intervention might be appropriate versus when patience is comfortable. The better approach truly takes practice and experience. It's not something you just pick up overnight, unfortunately. But with careful observation and maybe guidance from your vet, you'll definitely get there.
Okay, so once stage I is confirmed, and you've decided, perhaps with your vet's input, that calcium might be helpful, we move into what Dr. E calls the 45-minute decision point. This is your critical action timeline, and it's very specific. You need to watch the clock. After you've administered that first dose of appropriate oral calcium, there's a strict timeline to follow for observation. Within the first 15 minutes or so, you should be watching your queen very closely. You're looking for distinct signs of improvement. Are her contractions becoming stronger, more regular? Does she seem to have renewed energy and focus? Is she pushing more effectively? Sometimes you might even see signs of progressive cervical changes, like a kitten starting to crown. Understanding what normal progression looks like versus signs that might warrant immediate professional intervention becomes absolutely crucial at this stage. You need to be an active, informed observer, not just passively waiting around. But the absolute crucial decision point, as Dr. E outlines it, is the 45-minute mark after that first dose. This isn't an arbitrary number. Research shows this is a reasonable time frame for oral calcium to demonstrate effectiveness. If uterine inertia, that weak or absent contraction issue, is truly the problem. If, at this 45-minute point, you clearly see improvement, meaning contractions are stronger and more regular, she's progressing, and perhaps a kitten's even been born, then you can continue monitoring closely. You might repeat a dose, but only if her contractions clearly weaken again between subsequent kittens and still within the general guidance from your vet. This is about supporting her through the process if needed. However, and this is the most critical part, if there's no clear improvement after 45 minutes from that initial calcium dose, this is when you need to contact your veterinarian immediately. Do not give more calcium thinking it just needs more time or a higher dose. This delay can be incredibly dangerous for both the queen and her kittens. That 45-minute mark is your action trigger.
Okay, if we connect this to the bigger picture, what are the real concrete risks to the queen and kittens if I miss that window? If I keep giving calcium when it's clearly not working, instead of picking up the phone and calling the vet right at 45 minutes, it sounds like those 45 minutes are not just a guideline, but a very firm boundary for a very good reason. What happens if I ignore it?
They're absolutely a firm, non-negotiable boundary, and Dr. E is very clear about why professional guidance matters so much at the 45-minute mark if things aren't improving. Every minute counts when you're dealing with potential fetal distress from prolonged labor. Kittens in the birth canal are under stress, their oxygen supply can be compromised, and too much time can lead to poor outcomes, brain damage, or even loss of the kittens. It's that serious. There's also the very real risk of uterine exhaustion for the queen. If she keeps straining ineffectively, her uterus can become fatigued, which can lead to infection, uterine rupture in severe cases, and other really serious complications for her. And critically, there might be underlying mechanical problems, like that malpositioned or oversized kitten we talked about, or maybe even a uterine twist that calcium simply cannot fix. No amount will help. These situations often require surgical intervention, like a C-section, which needs to happen quickly to ensure the best chance of survival for the kittens and the queen. More calcium cannot fix mechanical problems. It just masks symptoms, wastes critical time, and delays proper veterinary treatment, which could literally be the difference between life and death for everyone involved. Understanding the difference between a uterine weakness that might respond to calcium and a mechanical obstruction that requires immediate professional care is vital. You're not just waiting, you're actively deciding with a deadline based on her response. Now let's talk about choosing calcium products, because understanding your options is really important, and as you'll see, not all calcium is created equal, especially for cats in labor. When it comes to product categories and their appropriate applications, the article recommends a few specific types that are generally most effective for queening cats. Commercial oral gels, specifically designed for breeding animals, are often a good choice. These are usually formulated for fast absorption, sometimes through the mucous membranes in the mouth, which is great for stressed animals who might not be eating or whose digestive systems are slower during labor. They're also formulated specifically for the demands of this period. Another good option mentioned are calcium citrate products. These are recommended because they work even when cats are stressed and perhaps not eating well, or if their stomach acid production is reduced due to stress, because calcium citrate doesn't require stomach acid for absorption, unlike some other common forms like carbonate. And then there are multi-salt blends that combine different calcium sources, like citrate, gluconate, lactate maybe. These are often preferred because they can offer both immediate absorption and a more sustained release, potentially providing a more consistent level of calcium support over time. This variety can increase the chances of effective absorption in different physiological states. However, and this is a truly crucial insight from Dr. E's blog post that could save you a lot of worry and, frankly, unnecessary intervention. With a complete and balanced commercial diet formulated specifically for reproduction, calcium supplementation is unnecessary in the vast majority of queening situations. This is a huge takeaway. Quality growth and reproduction diets are specifically formulated to meet all of the queen's increased calcium demands during pregnancy and lactation without the need for additional supplementation in most cases. So if your queen is on a truly excellent, well-balanced diet designed for this life stage, you might find you don't even need these products in your emergency kit, unless a very specific verified need arises under vet guidance. The diet might be enough.
That's a really powerful statement. So what does this all mean for my whelping kit then? Does this mean I don't even need calcium gels on hand if my queens are consistently on a top quality diet? Because for years, having that gel ready right there was just standard practice. It was part of the peace of mind, you know? It sounds like we might actually be over supplementing way more often than we realize, maybe when it's not needed, and potentially causing more problems than we solve by interfering.
That's a great question, and it really gets to the heart of the matter, doesn't it? While a good diet is absolutely foundational, the article doesn't say you never need to have calcium products available. It's not quite that black and white. It just clarifies that the need for them is far less frequent and for much more specific reasons than commonly assumed. It's about being prepared for those rare, specific situations where it truly is indicated by weak, inefficient contractions that are verified not to be a mechanical problem, essentially, true uterine inertia. It's about strategic use, guided by observation, and that 45-minute rule, rather than a general preventative or a first-line treatment for any slowdown. And just as important as knowing what to potentially use is knowing what to absolutely avoid. Dr. E lists products to steer clear of, definitely. Calcium carbonate alone, for example. We mentioned this briefly, but it's important to reiterate. It requires stomach acid to work effectively, and a stressed queen in labor often has reduced stomach acid production, making it poorly absorbed and therefore likely ineffective when you need it most. Injectable calcium is another definite no-no for home use. It should never be used outside of strict veterinary supervision due to serious immediate cardiac risks. It can affect the heart rhythm dangerously. This is absolutely not something for home use, ever. Full stop. And human antacids like Tums are also out. They're formulated incorrectly for feline physiology, the dosing requirements are different, and the calcium forms might not be ideal or balanced correctly for a cat's system. They're just not designed for this purpose. So the key principle to remember is that product selection should be based on the specific needs of your queen and the circumstances of her labor, ideally in consultation with your vet, rather than a one-size-fits-all approach. But most importantly, remember what we just discussed. Proper, high-quality nutrition often completely eliminates the need for calcium supplementation in the majority of cases. It all comes back to that solid nutritional foundation that supports her body's natural capabilities. Building on that, let's dive into some of the common calcium mistakes identified by Dr. E. These are practical examples of what not to do, based on real-world experience and the latest scientific research, offering vital lessons we can all learn from to avoid pitfalls. Mistake? #1. The just-in-case approach. This is incredibly common. I think we've all seen it or maybe even done it. Many breeders give calcium just in case when a queen seems a little uncomfortable, maybe restless, or is pacing a lot in late pregnancy before true labor starts. They think, better safe than sorry, I'll just give her a little boost to help things along. But as we learned earlier, this approach is not just benign. It can actually actively suppress the queen's natural calcium regulation system. Her parathyroid gland, which controls calcium release from bones, gets the signal that calcium levels are fine because of the supplement, and it basically goes to sleep right when she's about to enter labor, and needs that system to be wide awake and super active. So, instead of helping, you're actually hindering her natural physiological response, potentially setting her up for problems later. The smarter, evidence-based approach, as emphasized by Dr. E, involves patiently waiting for confirmed stage I labor signs and, crucially, working with your veterinarian to determine appropriate timing only if it's genuinely indicated by specific signs like weak contractions. It's about precision and understanding her body's signals, not prevention based on a hunch or general anxiety.
Yeah, I've certainly seen breeders who think better safe than sorry with calcium, especially maybe with a first-time queen, or when a queen just seems a bit restless and unsettled for a while before things really get going. It's a hard habit to break, I think, because it feels like you're actively doing something to help her, right? How do we explain that this isn't just ineffective, but actually harmful? How do we get breeders to truly internalize that message and resist that urge?
I think you explain it by focusing on that physiological mechanism we discussed, the body's natural feedback loop. When you introduce external calcium too early, before her body actually needs it for labor, her internal control system, that parathyroid gland, gets the message. Oh, we've got plenty of calcium coming in from outside, no need to work hard releasing it from the bones, so it chills out, it becomes less active. But then when actual labor begins, the queen's body needs a massive urgent surge of calcium, not just for contractions, but also for the colostrum and milk production that's about to start draining her reserves. That internal system is sluggish. It's not primed and ready to respond quickly. It's like a fire department that gets called off for too many false alarms and then is slow to respond to a real urgent fire. It doesn't just do nothing. It actively creates a potential deficit by suppressing her own natural robust system, making her more vulnerable to real hypocalcemia during the actual high-demand periods of labor and especially lactation. It's a fundamental misunderstanding of feline physiology, really. And once you grasp that mechanism, the just-in-case approach feels much, much riskier, doesn't it? Okay, mistake #2. Assuming more is better. When labor doesn't progress after that first calcium dose, the instinct for many is to just keep giving more. Maybe another dose every 30 minutes, thinking if a little is good, more must be better, or maybe she just needs more to get going. But this approach, as Dr. E highlights, wastes critical time. If the first appropriate dose didn't work within that established 45-minute window, remember, that's the research-backed time frame for effectiveness, if it's going to work. It's highly, highly likely that it's not a primary calcium problem. Giving more calcium just delays necessary veterinary intervention for whatever the real issue is, whether it's a mechanical obstruction like that malpositioned kitten, uterine inertia that simply won't respond to calcium, which happens, or something else entirely different. Following those established time limits and knowing precisely when to escalate care to your vet is absolutely essential. That 45-minute rule isn't arbitrary. It's a critical, potentially life-saving benchmark. Don't ignore it. Mistake, #3. Focusing only on labor. This is a huge one that's often missed, and it's where many breeders concentrate all their attention on calcium during the birth itself, yet they miss the much, much higher risk period for calcium issues, which is actually during lactation. Most eclampsia cases, surprisingly perhaps, actually occur during weeks 1 to 3 after birth, when queens are producing maximum milk volumes for the growing kittens. This is when the calcium drain from her body into the milk is truly massive, far exceeding the demands of labor itself. Think about it. A queen nursing, say, 5 or 6 hungry kittens is pulling immense amounts of calcium from her system every single day for weeks. Understanding this timeline helps you focus your monitoring efforts where they're most needed, shifting from just labor vigilance to crucial post-birth lactation vigilance, especially in those first few weeks. This also emphasizes why, if you're already doing it, proper progesterone testing throughout the reproductive cycle provides valuable insights beyond just timing breeding. It helps understand the queen's overall endocrine health and potential risks. And finally, mistake, #4, ignoring product quality. This goes back to what we discussed about different product types and their absorption rates and mechanisms. Not all calcium products are created equal, and this is particularly true for stressed cats who may have reduced stomach acid production during labor or post-birth stress. If you're giving a calcium carbonate product, for example, and her stomach acid is low due to stress, it might not be absorbing effectively at all. It's literally just passing through her system without her body utilizing it properly. Working with your veterinarian to select appropriate formulations, like those multi-salt blends or citrate-based products that don't rely on stomach acid for absorption, can make the critical difference between effective support and ineffective supplementation that just provides false confidence. You think you're helping, but the calcium isn't even getting absorbed and reaching the muscles where it needs to go. So product choice really does matter. Now let's transition to the often underestimated period of peak calcium demand, post-birth monitoring, specifically during the critical lactation period. This is where many breeders, maybe still focused on the immediate relief of labor being over, completely miss the biggest risk and the most common time for eclampsia, or milk fever, to strike. Here's what many breeders truly don't realize, and what Dr. E stresses repeatedly in her work. The peak calcium demand for a queen occurs during nursing, not during labor. A queen nursing, say 4 or more kittens, especially vigorous, fast-growing ones, can experience a truly massive calcium drainage. It far exceeds the demands of labor itself. Imagine the sheer amount of calcium being pulled from her body day in and day out, around the clock, to produce all that milk. It's physiologically enormous. This makes the weeks following birth, particularly the first 3 weeks during peak lactation, even more critical for queens with large litters, small-bodied breeds who naturally have less calcium reserves stored in their bones, those with a previous history of eclampsia, they're high risk, or queens who may have had poor nutrition during pregnancy. These are your absolute high-risk queens during lactation, and they require extra vigilance and monitoring during this time.
Okay, so I've got my beautiful litter on the ground. Everything seems to have gone well with the birth itself. Phew. Now, what are the absolute red flags I need to be looking for in those crucial first few weeks, and what does eclampsia look like in real time? I need concrete, specific signs, because I know every minute counts if it starts to progress, and panic can easily set in if you're not sure what you're seeing.
Absolutely. Knowing the predictable progression of eclampsia symptoms is vital, as it develops in a fairly clear pattern usually. Every breeder should understand this so you can catch it early. You need to be able to identify the subtle cues before it gets bad. The early warning signs are your critical window for immediate veterinary intervention. This is when you can make the biggest difference. Look for things like subtle facial twitching or lip smacking, almost like she's chewing something invisible or has something sticky stuck in her mouth. Excessive drooling, more than normal for her, can be another early indicator. You might also notice a general restlessness or pacing that seems abnormal for her post-birth, an inability to settle comfortably with her kittens, or fine muscle tremors like a slight shivering or trembling, often visible first in her legs or flank muscles, even if the room isn't cold. If you see any of these signs, even if they seem minor, That's your immediate cue to act fast and call your vet. Don't wait. This is your chance to intervene before it escalates into something much worse. As the condition advances, if it's not caught early, you move into the advanced stage. Here, queens may develop a stiff, unsteady gait, almost like she's walking on stilts or her legs are stiff and wobbly, especially noticeable in the hind limbs. She might find it hard to jump or move normally. She might seem disoriented or confused, not quite herself, perhaps staring blankly or not responding to her kittens or to you as she normally would. Acting spaced out. The tremors often progress from fine to coarse muscle tremors, becoming much more noticeable and generalized throughout her body. You can really see the shaking now. She might also become hypersensitive to touch or sound, startling easily at normal household noises, or flinching unusually when you try to pet her. This is a clear escalation, and she needs vet attention immediately. It's becoming serious. Finally, we have the emergency stage. This is truly life-threatening and requires immediate emergency veterinary treatment. You need to be on your way to the vet clinic right now. No delay. This includes full-blown seizures or convulsions, rigid muscle spasms where her entire body becomes stiff and locked, tetany, a dangerously high fever, typically climbing above 40.5 degrees C, which is 105 degrees Sierra, and ultimately potentially loss of consciousness or coma. Any of these emergency signs mean you need to get her to a vet immediately. There's no time to waste, as this is a true medical emergency that requires intensive professional medical intervention, usually intravenous calcium and fluids, to save her life. Knowing these stages can literally save her life, and indirectly, the lives of her kittens who depend on her. This brings us quite nicely to perhaps the most effective eclampsia prevention strategy, which, as Dr. E highlights throughout her work, begins with proper nutrition during pregnancy and needs to continue right through lactation. It's all about building a strong, robust foundation for her body before the demands hit. Prevention is key. To build that strong foundation during pregnancy, there are clear, actionable specifics outlined in the article. First and foremost, you absolutely need to be feeding a high-quality commercial diet that is specifically labeled for growth and reproduction, or all life stages, meeting AFCO protocols for gestation lactation. This is crucial because these diets are meticulously formulated by nutritionists to meet the significantly increased nutritional demands of pregnancy and lactation, including appropriate calcium levels and the correct calcium to phosphorus ratio, without overdoing it on the calcium side. Second, the recommendation is generally to implement free choice feeding, or at least very frequent meals, during the final trimester. This ensures she has access to all the calories and nutrients she needs as her litter grows rapidly inside her and her body prepares for the immense task of milk production. Her appetite will naturally increase significantly, and you want to ensure she can eat what she needs when she needs it. Third, and we simply cannot stress this enough based on everything we've discussed, you must avoid giving extra calcium supplements during pregnancy. This goes back to the deadly mistake of suppressing her natural, finely tuned calcium-regulating system right before she needs it most. Let the diet do the work. And finally, ensure the diet you choose maintains an appropriate calcium to phosphorus ratio, ideally somewhere between 1.1 and 2.1. Most quality reproduction diets will have this balance correctly, but it's worth checking the label. This delicate balance is absolutely vital for proper bone health and calcium metabolism, not just for the queen, but for the developing kitten skeletons too. This is the key insight many breeders miss, I think, because it runs counter to years of perhaps outdated conventional wisdom. A complete and balanced commercial diet, properly formulated for reproduction, provides all the calcium a healthy queen needs during both pregnancy and lactation in almost all cases. Additional calcium supplementation during pregnancy is not only unnecessary, but, as we've explored in depth, it can actually interfere with the natural regulatory systems that are designed to keep her calcium metabolism functioning optimally when the demand truly peaks. It's about empowering her body to do what it's designed to do, rather than trying to override it with excessive, premature supplementation based on fear.
So what's fascinating here is that the ultimate goal isn't to store massive amounts of calcium in her bones, like some kind of bank account that you then tap into during labor or lactation. It's more about keeping the queen's natural system sharp, responsive, and ready to mobilize calcium efficiently and quickly from her diet and bones precisely when it's needed. It's about empowering her body to do what it's designed to do with the right foundational nutrition backing it all up. This completely changes how I think about preparing a queen for breeding, focusing much more on her intrinsic health and metabolic readiness, rather than just thinking about adding a calcium supplement as a quick fix later on.
Exactly. Understanding that the goal isn't to simply stuff more calcium into the queen's body beforehand, but rather to keep her natural calcium regulatory system, that parathyroid gland and vitamin D pathway sharp and responsive for when it's truly needed, changes everything about supplementation decisions. And, you know, cats' natural high-protein diet creates an acidifying effect that actually helps keep their parathyroid system active and efficient, which is a unique advantage compared to some other species, like dogs, potentially. Their bodies are naturally designed in many ways to handle these calcium demands better than many other animals, provided they have the right nutritional building blocks. This understanding of reproductive success markers helps breeders focus on what truly matters for optimal outcomes, which is robust overall health through proper tailored nutrition throughout the entire cycle. Dr. E does briefly mention in her article that specific types of diets, often those suitable for all cats from pregnancy right through to the end of lactation, are frequently available through professional veterinary or breeder programs and are certainly worth investigating with your vet. This just underlines the importance of choosing a diet specifically engineered by experts for these demanding physiological states, rather than just using a generic adult cat food and hoping for the best. Given all this detailed information, all these nuances, it becomes critically important to know exactly when veterinary intervention is absolutely essential. No question. This isn't about second-guessing yourself or panicking unnecessarily. It's about having clear, predefined decision points so you can act swiftly and decisively when needed. During labor itself, immediate veterinary consultation is needed if you observe certain undeniable red flags. Write these down mentally. For example, if there are 60 or more minutes, a full hour of active, strong, visible straining with no kitten appearing, that's a clear, urgent sign something is physically wrong and cannot be fixed at home. Time to go. Or if there are 4 or more hours between kittens being born, especially if the queen seems to have stopped active labor or seems exhausted. Labor should generally be progressive, and significant gaps like that indicate a potential problem that needs professional assessment. Foul-smelling or abnormal discharge, maybe dark green or black discharge without a kitten quickly following. Some green discharge with a kitten can be normal placental fluid, but timing matters. Or pus-like discharge is another serious warning sign of potential infection, placental separation, or fetal death. Of course, any signs of extreme distress or collapse in the queen herself, if she's suddenly very lethargic, unresponsive, showing signs of severe pain, or bleeding excessively, more than just normal post-birth spotting, demands immediate emergency attention. And finally, reiterating our earlier crucial point about the 45-minute rule. If there's no clear improvement in contraction strength or labor progression within 45 minutes after you've administered that first appropriate dose of oral calcium, that is your definitive, non-negotiable signal to call the vet immediately. It means calcium isn't the solution to her specific problem, and delaying will only make things worse for her and the kittens. Then, after birth, the vigilance continues, focusing on that critical lactation period, and emergency veterinary care is required for a different set of symptoms, primarily related to eclampsia or other postpartum complications. Any eclampsia symptoms, which we just detailed, those tremors, the twitching, the stiffness, disorientation, seizures, or high fever, are absolute emergencies that require immediate professional medical treatment. Don't hesitate. If the queen is completely rejecting all her kittens, showing no maternal interest, or seems completely unable to care for them, maybe she's too weak or distressed, there might be an underlying issue like pain, infection, mastitis, or metritis, or profound weakness from eclampsia that needs addressing by a vet. Lack of appetite for 24 or more hours post-birth is also a significant concern. She needs to be eating robustly to support lactation and her own recovery, so a prolonged lack of appetite warrants a vet check. And of course, any signs of infection, such as fever, lethargy, a foul-smelling vaginal discharge developing days after birth, or any suspicion of a retained placenta, which can cause serious uterine infection or metritis, requires immediate veterinary attention. These are not wait-and-see situations.
This becomes such a clear, actionable checklist for breeders on the ground, doesn't it? When I'm in that stressful moment, I can just run through it mentally. Have I waited 45 minutes since giving calcium with absolutely no improvement? Is my queen straining hard for 60 minutes with no kitten? Are there any signs of extreme distress or abnormal discharge? If the answer to any of these is yes, I know exactly what to do. Pick up the phone and call the vet. It removes so much of the guesswork and a huge amount of the emotional stress and uncertainty from those incredibly high-pressure whelping moments. It gives you a clear plan.
Exactly. It's about having that framework firmly in mind before you even start. Now let's briefly look forward, as Dr. E's insights also touch on some exciting potential advances in feline reproductive care that are on the horizon, things that might change how we manage this in the future. Current research is exploring several promising directions that may significantly enhance our understanding and management of calcium in breeding cats down the road. Scientists are investigating gut bacteria optimization, for example. The idea is that certain specific microorganisms in a queen's gut microbiome may actually enhance calcium absorption from her food through improved intestinal function. Imagine being able to fine-tune a queen's gut health specifically to better utilize the calcium in her diet. That could be amazing. Another really fascinating area is the potential development of real-time calcium monitoring technology. Similar perhaps to the continuous glucose monitors used for human diabetics, such technology could eventually provide breeders and veterinarians with instant, continuous feedback on a queen's blood calcium status during critical periods like late gestation, labor, and early lactation. That would truly be a game changer for precise, proactive intervention, wouldn't it? Additionally, genetic screening research aims to identify queens who may be genetically predisposed to calcium metabolism disorders before breeding decisions are even made. This could allow for highly targeted proactive management strategies or inform different breeding choices altogether to reduce risk.
Wow, if we connect this to the bigger picture, just imagine having real-time calcium monitoring available on the whelping floor. How would that change how we support our queens? It would shift us completely from being reactive, based on visible symptoms that are sometimes subtle or easy to miss initially, to being truly proactive based on immediate, hard physiological data right there in front of us. It's really exciting to think about the possibilities.
It would be absolutely revolutionary, giving us unparalleled insight and the ability to intervene much earlier and more precisely. And speaking of individual care, the article also emphasizes the important shift toward individual management over making broad breed generalizations when it comes to calcium. While some fine-boned breeds, like maybe Siamese, Oriental Shorthair, and Cornish Rex, appear perhaps more frequently in anecdotal reports or case studies of calcium-related problems like eclampsia, large-scale epidemiological studies, that's studies looking at patterns and causes of disease in large populations, are still needed to definitively confirm true breed predispositions versus other confounding factors. The most effective approach, therefore, currently focuses on individual queen management. You need to tailor your support and monitoring based on her specific history. Did she have problems before? Her litter size, larger litters increase risk. Her body condition, her diet, and her specific needs during this pregnancy and lactation, rather than making assumptions based solely on her breed characteristics. Every queen is an individual, and her specific situation should dictate your approach. Finally, let's bring it all together into what Dr. E effectively calls your partnership strategy for calcium management. This isn't about you, the breeder, doing it all alone. It's about developing a comprehensive, ongoing partnership with your veterinarian throughout the entire reproductive process. This strategy involves several key phases, providing a clear roadmap for you as a breeder working with your vet. Before labor even begins, your foundational focus should be on feeding that high-quality reproduction diet consistently. That's paramount, as we've stressed. Have appropriate, vet-approved oral calcium products on hand just in case they are needed later for a specific reason. But remember to absolutely avoid that tempting preventive supplementation during pregnancy. Take the time to learn to recognize those stage I labor signs clearly and confidently so you know when things are really starting. And critically, establish clear communication protocols with your veterinary team before you need them in an emergency. Know who to call, when their emergency hours are, what information they'll need from you when you call. Be prepared. During labor, the approach shifts to careful, evidence-based observation and intervention only when indicated. Wait for confirmed stage I signs before considering any intervention at all. If calcium seems appropriate based on weak contractions and no blockage suspected, follow your veterinarian's guidance on appropriate product choice, timing, and dosing. Adhere strictly to that 45-minute improvement assessment window after the first dose. It's your critical decision point. And crucially, avoid repeated dosing without professional consultation when no improvement is observed. This isn't a more is better situation. It's a call for help situation when calcium isn't working. After birth, your focus must move to vigilant monitoring for eclampsia signs during the critical weeks 1 to 3 period when calcium demand peaks due to milk production. Support those heavy lactation demands through continued high-quality nutrition and potentially with specific vet-approved supplements only if indicated for specific high-risk queens, like those with huge litters or a prior history. Maintain extra vigilance with those high-risk queens, those with large litters, the smaller breeds, or any queen with a history of eclampsia. And always remember, having labor problems doesn't necessarily predict lactation problems, and vice versa. There are distinct periods of physiological stress and risk, each with its own set of potential challenges that need monitoring. This entire approach is rooted in an evidence-based approach. The latest research, particularly that 2021 study Dr. E cites showing zero low calcium during dystocia, has fundamentally changed how veterinary professionals think about calcium's role in cat breeding. Most labor problems aren't primarily calcium issues, and even when calcium deficiency is involved, more likely in lactation eclampsia, precise timing, appropriate product selection, and professional guidance matter far more than just the dosage alone. Your goal as a breeder isn't to become the person who administers the most calcium, but rather to work intelligently and collaboratively with your veterinarian to provide targeted support at exactly the right moment for exactly the right reason, with proper professional oversight. When you truly understand the science behind your queen's calcium needs and work within a strong veterinary partnership, you move from reactive guessing and maybe outdated habits to strategic support based on concrete evidence and expert advice. This represents the difference between just hoping everything works out okay and confidently managing each situation with appropriate professional guidance, leading to the best possible outcomes for both your queens and their precious kittens. So the next time labor complications arise, you'll hopefully feel more empowered. You'll know whether to implement specific supportive measures based on evidence or whether it's time to immediately contact your veterinarian. And that knowledge, combined with that professional partnership, provides the best outcomes.
Absolutely. This deep dive has truly highlighted how moving from those old habits and assumptions, the way we've always done it, to embracing these evidence-based practices can make such a huge difference on the whelping floor. It's about being prepared, being smart, knowing your queen, and knowing exactly when to intervene appropriately, and perhaps more importantly, knowing precisely when to stop intervening yourself and call for professional help without delay. This knowledge gives breeders incredible confidence. It saves precious, critical time in emergencies, and most importantly, it can literally save lives, both queens and kittens. It's truly empowering to have this understanding.
For the full protocol Dr. E recommends, more details on the products and other breeder-ready tools, definitely read Dr. E's complete article and consider joining the Breeder Vault. We'll put the link in the show notes for you.